Okay, we're going to get started. Hi everyone, this is Nicole, LuckyVitamin's Category Manager of Personal Care, Beauty, and Aromatherapy items. It's great to have so many joining us today for the LuckyVitamin Wellness Webinar, Sinus Rinse, Is It Right for You? Thank you all very much. We are pleased and honored to have with us today Lisa Stillman. Lisa has been a xylitol educator for Xlear and Spry for 6 years, focusing on the Northeast United States. She is a knowledge expert regarding the benefits and use of xylitol in the sinuses and mouth. She is a registered dental hygienist with a special interest in breathing and airway. And Lisa has practiced dental hygiene in Maryland and Virginia and currently has a position specializing in periodontics. Lisa has also created an organization called Dental Voice for Mental Health that assists mental health care recipients in caring for their oral health through National Alliance of Mental Illness health fairs, speaking at mental health facilities, and writing articles. So before I turn things over to Lisa, just a few quick reminders. This webinar is being recorded and will be emailed to you after its conclusion. If you have any questions during today's webinar, please enter them into the question box on your screen. At the end of the webinar, we will try to answer as many as possible. A promo code will be given at the end of the presentation and will be available for 72 hours. Thank you all again, and now I'm going to turn it over to Lisa.
Thank you very much. I appreciate it. I really appreciate you all being here. Let me show my screen. Okay. All right. Okay, good. So you can see my screen, I'm hoping. It looks like you can. So I named mine Sweeten Your Life with Xylitol, Keep Your Nose Clean. Because basically, if you can keep areas on your body clean, you will keep yourself free of infection and problems as such. Again, thank you very much for having me. I really appreciate it. I am a dental hygienist and a clinician, and I do write articles about xylitol. I also write articles about severe mental illness and oral health, and I do speak at webinars and presentations at dental shows and so forth. So what is xylitol? Xylitol is a natural sweetener. It is a wood sugar. People think of it as an artificial sweetener, but it is not. It was discovered way back. The Native Americans used to use birch trees, the little twigs off of birch trees to be able to clean their teeth. And because of the xylitol in that birch bark, it actually helps to clean the teeth. So it is natural to us, and it tastes just like sugar. I don't know if you've ever tasted it or not, but when you put it in your mouth, it's made of crystals, and there is no aftertaste, but there is a cooling effect, and it actually enhances the taste. It's in all of our fruits and vegetables. Because it is a wood sugar, it's in every fiber of every plant. It's also part of what we call the Krebs cycle. That is the cycle that converts our food into energy. So our body needs xylitol in order for that to happen. That is one of the cycles, or one of the part of the process. So we need that molecule, that xylitol molecule, for that to happen. And if we don't eat enough throughout the day, our body will actually produce about a teaspoon of xylitol per day, and we process it in our liver. We metabolize it in our liver. So it is natural to our bodies, and our body needs it. It is not natural to animals or to dogs, just so you know. And it's very important that we tell people not to let our dogs eat xylitol. It is great to use it to replace sugar. We know that sugar actually acts as a poison in our body, and sucrose is what I'm referring to. And everything out there has sugar in it, just about put in there. It's kind of hidden until you start reading the labels, and then you see it in there. And one of the ways you can test how much sugar you're actually receiving in a drink or in a food is to add up the amount of carbs and divide it by 4, and that's how many teaspoons of sugar you're actually getting. I use that a lot, actually. Xylitol is great for cooking and sweetening foods, and you can use it in place of sugar 1-for-1. A cup of xylitol would equal a cup of sugar. The only thing you cannot bake with it is bread with yeast, because yeast cannot metabolize it, so it won't rise, and you can't cook hard candy. You won't get hard candy made out of it because it will not harden. It does. You have to heat xylitol to about 700 degrees in order for it to crystallize. But everything else, cakes, cookies, those kinds of things, you can cook with it. Xylitol is very safe for diabetic patients. Diabetic patients cannot eat a lot of sugar. It causes too much insulin to be called for in their body. So the beauty of xylitol is that it's a 7 glycemic index, and so it does not pump a lot of insulin into the bloodstream. It's a very slow release of insulin. So diabetic educators actually recommend xylitol for their patients. And there's 40% less calories in a teaspoon of xylitol as compared to sugar. So it's good for weight loss as well. But it is not safe for dogs. The reason it's not safe for dogs is that their dogs' bodies cannot metabolize it. They can't metabolize it because it's not natural to their body. And when they do ingest xylitol, it pumps too much insulin into their bloodstream, and they go into what's considered a diabetic coma. Very serious. So the anecdote would be to give them a teaspoon of xylitol every 10 minutes before you get them to the vet. So this is a big deal. I always mention it when I talk about it, because there's a lot of dog lovers out there. I'm a dog lover. So you want to think of xylitol as therapy and as medication, and it's for us, humans, and for dogs, you want to keep it away from dogs. Just think of it in a sense sort of like therapy, a product that you use for therapy. Xylitol, they discovered that xylitol reduced tooth decay during World War II. And it was very interesting because Finland was a country that could not get any sugar during World War II. So they relied on their birch trees for their sweetener, xylitol. They called it birch sugar back then. Just put that in all their food. And dentists realized that there was a drop in dental decay. So then after the war had stopped, dental decay rose again, and they were really excited, and they did a lot of testing on it. When they did the test, they did it in Finland, and they did it in the school system. They gave half the kids xylitol gum and half the kids gum with sucrose in it. They compared the two over a couple of years, and they realized there was a dental decay drop in 70% in that population that used the xylitol gum. They were really excited. Not only did they realize that it helped with reducing tooth decay, but there was a 42% drop in ear infections. And they were very interested in that, so they started testing that too to find out why did it help with tooth decay and why did it help with ear infections. And we'll get into that in a minute. I have a lot of research on this. I'm happy to share my email address with anyone if you want. If you have questions after this is over, even down the road, if you have a question, shoot me an email. Be happy to answer that. And if you want any research, let me know. I'd be happy to send that to you as well. So we know that oral health in the dental industry is definitely connected to the rest of the body. And more information is being put out there in the media talking about oral health and heart disease and diabetes and different things like that. And so we also know that good oral health improves the susceptibility to respiratory pneumonia and other illnesses. But not just oral health, but also sinus health is very important to be able to keep the sinuses clean, the mouth clean, to keep the rest of the body clean, because that is the gateway to the body. Breathing through the nostrils, having that area cleaned daily, and cleaning your mouth will keep the rest of the body much healthier. So what happens is, let's talk about something else. It's all associated with, it's called biofilm. And that is the premise of infection. And what is biofilm? Well, biofilm collects in our mouth and collects in our nasal passages. It collects on our skin. What it is a colonized type of bacteria, virus, and fungus. They live together in a very highly sophisticated, very organized type, and they have their own ecosystem. They have this what's called a slime layer that covers the entire biofilm and keeps them intact. The reason I talk about this is because that is, you can have an unhealthy biofilm or you can have a healthy biofilm, depending on if it's, that area is, you're able to get to it and clean it. So by brushing your teeth, you're mechanically disrupting the biofilm in your mouth and getting that plaque off your teeth. By washing your hands, you're mechanically washing the biofilm off your hands. What you're doing essentially is keeping the pressure on those surfaces, on those areas, that when the new biofilm has to be recreated, it's much more simple. And so what you're doing is you're crowding out, you're washing away the bad bacteria and allowing the good bacteria to take over. We need to have biofilm in order to live a healthy life, but we need a healthy biofilm that supports health, not an unhealthy one. So we have biofilm in the nasal passages as well. We have bacteria, fungus, and viruses. We breathe over 10,000 times a day. And when we take in air, one breath, it takes an hour for that filtered air to get to the back of, well, the air goes in immediately, but for the pollen, the fungus, any bacteria, any viruses that we may have breathed in, to work its way to the back of the throat, and we swallow it. So how does xylitol work? Let's talk about oral health for a minute. How does it work for oral health? For dental benefits, it acts as a biofilm buster. So when we take in a xylitol, like say it's in chewing gum, and we chew that, what happens is the saliva becomes saturated with that xylitol. And when that happens, the bacteria cannot stick to each other anymore. They lose their stickiness and they wash away. The reason that happens is because xylitol is what's called a 5-carbon sweetener, or it has a 5-carbon molecule. It is set apart from the other sugars that we know that cause tooth decay, such as sucrose, fructose, lactose, sorbitol, mannitol, maltitol, and many, many others, as well as our own sugar, glucose. Those are 6-carbon sweeteners. When they are ingested by the biofilm in the mouth, they digest it, and then they start to grow. And when they grow, they cell divide. When that cell division happens, it causes acids to be released, and it creates a stickiness. That stickiness is what is used to protect the biofilm, and that is the slime layer that I'm talking about. Now, within that slime layer, this bacteria and fungus and viruses and other microorganisms, they talk to each other. They communicate with each other, and they attract more. And that's how it becomes much more colonized, much more sophisticated. When they ingest a molecule of xylitol, they lose their communication skills. It's like knocking out their cell towers. They can't communicate with each other. It's like poking holes in their slime layer, and they no longer can communicate. They lose their stickiness, and they just wash away. So it's not killing the bacteria. It doesn't kill fungus. It doesn't kill the viruses. It just keeps them from being able to grow. And when they wash away, then they have to start all over to create their colony again. And when you do this over and over and over again, the bacteria that end up being able to survive in that environment become a friendly bacteria to us. It's just like washing your hands. several times a day. You're washing away the bad bacteria so that the friendly bacteria can survive and live on our hands, and that's what keeps our hands healthy. If you mix a 6-carbon sweetener with a 5-carbon sweetener, such as in other products like a sugar with a xylitol or xylitol with sorbitol and something like that, what happens is the biofilm ingests that xylitol first, and then they start eating the other sugars, and they are able to continue to grow. So this sounds a little complicated, maybe to some, but actually this is the premise in how xylitol works and why it's set apart. And people are going to say to you, well, why would you advise me to use a sugar? Why would they put a sugar in a nasal product? Why do they put a sugar in a dental product? Because it actually inhibits the growth of bacteria. They lose their stickiness and they wash away. Xylitol works against all of your strep pneumonia, your pharyngeal strep throat. There's over 220 strains of strep, as well as MRSA and staph. Now, MRSA actually lives or resides in the nasal passages, and that's important to remember if you know somebody that has MRSA, because they need to be able to clean their nose so they don't pass it to other people. Candidiasis or fungus is definitely affected by xylitol, as well as some influenza. Now, the slide on the left is intact biofilm, and that is taken from somebody's mouth and put it on a slide, looked under a microscope. The one on the right is after it's been exposed to only 3% xylitol mixed with water. As you can see, the biofilm has become dispersed, and they are no longer sticking to each other, and they wash away. So it does not kill it, it just washes it away. Dental benefits also that it hydrates the mouth. It makes the mouth water. As soon as you put xylitol in your mouth waters profusely. And I will explain why I'm talking about the mouth, because this has everything to do with the nasal passages as well. Many, many risk factors for dry mouth. So people may come to you and say, my mouth is really dry. And then you will be able to tell them about the xylitol. It really works. It has a cooling effect. It also neutralizes the pH. The pH of xylitol is about a 7.0, which is perfect for the mouth and other areas in the body. So as soon as you put xylitol in your mouth after you've eaten, the pH will rise to a balanced pH. And it helps remineralize the teeth. So those are just a few of the things that xylitol does for the mouth, which is very important to keep your enamel and your teeth intact. So xylitol works because if the pH is about a 7, it increases saliva, and it actually keeps the bacteria from producing acids. And it actually gets those calcium phosphate ions that are in the saliva to go back into the tooth surface. So we recommend that you use it 5 times a day to keep the pressure on the bacteria in the mouth, so that when it starts to reform again, then they ingest the xylitol and they wash away. It takes about 5 times a day for it to be truly effective. So by using it in the morning and at night and after each meal is about 5 times a day. But what about upper respiratory and nasal health? What does that have to do with the nose? Well, we have many issues with the upper respiratory problems. People can get sinusitis. They get inflamed linings in the sinuses themselves. They get excess mucus and infection, as opposed to having a healthy sinus. And again, we breathe over 10,000 times a day, and we are exposed to all kinds of different toxins, pollens, bacteria, all of that as we breathe. When we take the breath in, it's best if you can breathe through your nose, because then what's happened is the cilia in the nasal passages cleanse that area and allows our own body's defense mechanism to work. Xylitol can help reduce seasonal allergies as well. When we get too much pollen in the nasal passages, what happens is the histamines are released. The histamines are our own natural defense mechanism, and that makes our nose water, it makes our eyes water, and we sneeze. It's an immune response to getting something in our nostrils that shouldn't be there. We're trying to clean it out with the sneezing and the wateriness that we get. Our ears may be itchy. They can create a buzzing sound. All of that happens in an itchy throat, and we cough and we sneeze. And a lot of times when that happens, people will take an antihistamine because they want to be able to continue on their day. They don't think about cleaning the nostrils out. They just think about stopping the symptoms. And antihistamines can do that for us. So it's really important that we allow our own body to heal. And by keeping the nose clean, then we don't have that histamine response happening. So how does Xlear work? Well, Xlear is a saline solution with xylitol and grapefruit seed extract as a preservative. When you put it into the nostrils, what happens is it keeps the cilia from hardening up. It allows the humidity in the moisture in the nasal passages to, as soon as you put it in your nostrils, it actually shrinks the tissues. It has, again, the cooling effect that it does in the mouth. And when you put it into the nostrils, that cooling effect absorbs this fluid out of the tissues, and immediately you get a decongested type of reaction. And so then you get more fluid in there, and it thins the mucus. When if those cilia are allowed to stay stiffened, which they will, they stiffen up when you go from a very into a dry area, and say whether it's heat or air conditioning, in and out, and that type of thing. The cilia are there to actually sweep the bacteria, viruses, and pollen to the back of the throat. And as long as they can work, then we can keep that area clean. But once they become stiffened and we breathe, we start holding on to those toxins and the pollen and the different other type of microorganisms. As long as we hold on to them, then they build. And that's when the histamines in our system start to be released so that we can clean that area out naturally by sneezing. If we allow it to stay in there by taking antihistamines, then they will start to invade the tissues and cause infection. So what Xlear does is by using it, it will keep that cilia working. Another problem, another cause of the cilia not working is when people use steroids, like Nasacort and different other medications that for the nose that has cortisone in it. They actually paralyze the cilia or the nasal hairs. And so by using Xlear nasal spray instead, you keep that cilia action moving and going. It also inhibits the bacterial formation. It does the same thing to the biofilm in the nasal passages as it does in the mouth. It causes that biofilm to break up, and it can't stick to the nasal passages anymore, and it washes away. So using the medical solution really does not work. We need to keep our body healthy, keep our natural defense mechanisms working, and support health, and keep those tissues in our nasal passages healthy as well. So we recommend that you use it morning and at night for prevention. But if you get ill, say you get allergies, asthma, sinus infection, those kinds of things, you can start using it every 3 to 4 hours. It has what's called a substantivity of 3 to 4 hours. In other words, it goes into the tissues and it holds onto the tissues and keeps working for that long. But you need to keep the pressure on the biofilm to keep it clean and healthy. So we recommend that you use it every 3 to 4 hours when you're sick. So if you start getting a cold or your allergy season is coming on, you want to increase the use of the Xlear nasal spray. Or if you go on an airplane use it about every half hour because you're breathing some air that is not really very healthy, and people get sick after they've been on these airplane trips. So again, it has sinus benefits. It is a biofilm buster. It hydrates the nasal passages, and it's considered hyperosmotic, which means it causes the extraction of those fluids. It actually causes the tissues to release the fluids, and you get immediate open airway, much more so. Even if you think that you have an open airway and you use the Xlear nasal spray, you'll be able to breathe even better. And it helps to neutralize the pH in that area so that the good bacteria will grow. So there's many, many positive effects with having fewer sinus infections, and you can keep your body healthier. So by using it for about 6 months, it actually causes the area to become healthier and to support health, and you'll have fewer sinus infections, fewer allergies, and fewer colds in the future. Xylitol also prevents ear infections in children, and that is how we first came to realize how xylitol works in the nasal passages. Dr. Lon Jones is an osteopath, and he practices in Texas. And he wanted to discover a product that would prevent ear infections in the babies in his practice. Well, remember when I talked to you a few minutes ago about the research that was done on the children in Finland when they gave the children the gum? Half the children got xylitol gum and half the kids got sucrose gum. Not only did it reduce tooth decay, but it also reduced ear infections by 42%. Well, so Dr. Lon Jones thought, well, that is amazing. And because of that, but we can't give children gum and we can't give them mints. So he put the xylitol in saline solution and gave it to each child after every diaper change. And it was reduced sinus infections by 90%, or ear infections. See, babies' eustachian tubes are very short, and they get clogged very easily. And they also are horizontal, so they're very prone for ear infections. As they grow, the eustachian tubes become more vertical, and so you don't get ear infections as often as an adult. So because of the little teeny weeny intricate areas in the child's middle ear, that is what happens. And the eustachian tubes are actually in the back of the throat. So that's why having it in the saliva, chewing the gum, prevents ear infections. But not as much as actually putting it in the nostrils and getting it in that area directly. This is Dr. Lon Jones. He is the person that created and patented this Xlear nasal spray. After he discovered that it worked for children, he discovered that it worked for sinuses and adults as well. And it is the same concentration for children as it is for adults. So these are his first prototypes, and he used this in his children's practice, and he had people coming from all over to get his nasal spray to reduce ear infections. So all you need to do is after each diaper change, or put it in the nostril at about 5 times a day to prevent ear infections. That's what they found out. And it also does prevent upper respiratory problems that we talked about. We have it not only in the nasal spray, but we also have the neti pot and the positive squeeze bottle as well. So the sinus care, we have a whole sinus care packaging. And it comes in the children's nasal spray, and we have the box where it has the 3 sizes and the nasal spray for adults. It also helps reduce asthma attacks. By keeping the nasal passages clean and keeping that pollen out, the body does not recognize it as a problem when they breathe it in, and so there's fewer asthma attacks. And this is a book that Dr. Lon Jones wrote, and it is available from us, or get it on Amazon.com if you want to read more about it. So he pretty much says just keep your nose clean. You keep your nose clean, you'll keep yourself healthier. So let's talk about nose breathing versus mouth breathing a little bit. It's very important to breathe through your nose. You'll get 20% more oxygen if you breathe through your nose than your mouth. And we care about that in the dental field because it's very connected to dentistry when people do breathe through their mouth. It causes a lot of issues, and the benefits of nasal breathing is that you do get more oxygen, you get more stamina, endurance. It increases reduces your stress, and it increases relaxation. Children that breathe through their mouth a lot of times will exhibit ADHD symptoms during the day to try to stay awake, because if they breathe through their mouth during the night, they're not getting enough sleep. A lot of times they wake up. So you want to catch them while they're young. You see a lot of children breathing through their mouth. When my children were little and they breathed through their mouth when they were sleeping, I just thought it was normal, and I thought it was very cute. But when left untreated, what happens is this picture on the left is this little child is breathing through their mouth, very cute, very sweet. But by the time this little girl turned age 9, she had developed an elongated face, and her ortho was not, her teeth came in very, very crowded. And that is due to mouth breathing. What happens is the palate becomes much more narrow. And this is another child here on the left. He's breathing through his nose, his lips are together, and then he probably got sick. Maybe he had asthma, maybe he developed allergies. He started breathing through his mouth, and he developed a whole different developmental, his bone structure is different, and as you can see, his lips are flaccid and they're not tight. This little girl here on the left, you can see that she is a mouth breather, but on the right, she has had treatment and has learned to breathe through her nose. So Xlear nasal spray really, really helps if you are going to attempt to start breathing through your nose. You need to open up that airway for that to happen. This is a little testimony of this little guy here. This doctor had given him a diagnosis of failure to thrive. He was only in a 3T and a 4T size clothing at the age of 6. His mom started using the Xlear nasal spray and teaching him how to breathe through his nose. And after he saw one of our seminars, and this is only 3 months later, he's grown so much. He's much more alert, and this is a year later. So he is in the same size as his classmates. This is when he is in 2nd grade. So amazing testimony that was sent to us, and we can talk more about that at another time. I would be happy to share that with anyone that has problems breathing through their mouth and wants to learn how to breathe through their nose again. You have to do a little bit of therapy, and it can work for almost anyone. So the decision, I think, is clear that regular cleansing of the nasal passage is very important in preventing illness, and using this nasal spray really does help in many different ways. I tell my patients all the time about this and try to get them off the steroids, antihistamines, and decongestants. So for ear, nose, and throat, we recommend the Xlear Kids Xlear and the Sinus Care. For dry mouth, we recommend the mouth spray and any of these mints and gum if you have a sore throat. If you are suffering from upper respiratory problems, using these items is very helpful. So, and people ask me all the time, well, what happens if will you get like a diarrhea type from it? If you ingest too much of it too quickly, what happens? It acts as a fiber. It loosens the stool, and you will go to the bathroom more often. But if you use it for dental reasons and for sinus care, that's not going to happen. You need to put it into your diet, like make sweet tea out of it, lemonade, that kind of thing. And it takes about 2 weeks if you're going to put it into your diet on a regular basis for your body to adjust. So for me, it's about 40 grams. Here it says for children 45. But for the average adult, it's about 100 to 150 grams a day, which would be a lot of xylitol. So this is our sinus care line and our gum. And this is our oral rinse, our gems, our mints, and our other mints that we have. And thank you very much. I'd be happy to take any questions that you may have for me.
Thanks, Lisa. That was all great information. So we did receive some questions. The first one I'm going to start with is, I believe when you started touching on how xylitol was found, you were discussing the birch tree. So someone is actually allergic to birch pollen, and they would like to know if that would have an effect. Would that be a problem if they use xylitol?
That's a good question. No, it does not have any effect on xylitol, whether it comes from birch. Ours actually comes from non-GMO corn cobs. Ours actually comes from non-GMO corn cobs, but it has no essence of the birch in it or corn, no matter where you get xylitol from.
Okay, perfect. That's reassuring for that user that asked the question. And now, I know you talked about dogs not being able to ingest xylitol, but is that for all animals or just dogs? What about cats?
Well, cats don't seem to be interested, so I don't think we have any information about cats. It's dogs that will root. You know, they smell that mint, they smell that gum, and they'll root through your purse for it. And, you know, dogs have a tendency to like to eat, you know, people food. So if you make cookies out of it, don't give a dog cookies with xylitol, that kind of thing.
Okay, perfect. The next question, now I know you recommend sinus rinse, and a bunch of people would like to know, it's okay to do sinus rinse daily? Is there a schedule that they should be following, or they definitely should be doing it every day?
Doing the clear nasal spray, you can use that as many times as you want. And doing the neti pot with the clear, I don't know the answer to that question. I don't know whether doing it that once a day in the neti pot. I understand that it's okay to do it once a day. I mean, people do it all the time. Doing it more often, I don't know if it would hurt the sinuses. I really don't know the answer to that question. I'm sorry. I can find out.
Okay, so the xylitol spray is okay, though, to use every day. It wouldn't have any negative effect on anyone, or, I mean, obviously you're not a doctor, but as far as we know, it doesn't have any negative effect using it daily.
No, the clear nasal spray, you want to use it in the morning and at night for prevention. And if you're sick, you need to use it every 3 to 4 hours. That is, you can use that forever, and you're not going to have any problems at all. But when it comes to, you know, putting all that water in the nostrils with the neti pot as compared with the neti pot, I don't know. But using the clear nasal spray, it's going to work fine.
Okay.
You can use that as much as you want. Mm-hmm.
Good. Okay, that's great. So I'm not sure if you'll be able to answer this question, but one person entered a question that they're allergic to xylitol. So they wanted to know if you had any alternative options for them.
Allergic to xylitol. I've never done anybody be allergic to it. Now I can see if it causes an intestinal problem. An alternative to it, if it causes too much intestinal problem, no, I don't have an alternative to that. I don't know what the allergy would be other than that.
Okay.
No.
Well, thanks. So maybe they could just try, you know, like the regular neti pot, saline wash and see how that works out.
Right, just the sinus, the sodium bicarbonate, pharmaceutical grade sodium bicarbonate, I suppose, would be fine. Right. Mm-hmm.
All right. Well, if anyone else has any other questions, feel free to type them in now. But that pretty much wraps it up. So thank you all again for attending, and thank you, Lisa. That was a great presentation, very informative. If you have not already done so, please register for our upcoming webinar. and that one is called The New Science of Anti-Aging with Timothy Mount on Thursday, March 3rd at 2 p.m. Eastern. For more information, please visit LuckyVitamin.com and search keyword webinar. So please see the screen now for the exclusive promo code. This code can be used on select products, and just a reminder, this code is active now and will be active for the next 72 hours. And that concludes our webinar. We didn't get any other questions. So thanks again for joining us, and thank you, Lisa. And everyone, remember to spread the wellness.
Thank you very much. Bye-bye, everybody.